Plant-Based Kidney Health. I'm Michele Crosmer, Renal Dietitian. Dr. Hashmi, do you want to introduce yourself?
I'm Hashmi, nephrologist and obesity medicine doc. Nice to see everybody again. Thank you for joining.
Yes. And let's dive right in because we usually get tons of questions in the live chat. That's where you can put your questions if you're here live with us. Otherwise, we have some that we'll start going through as we wait for those to pop in that people had submitted ahead of time. And let me make sure. Okay, I can see the chat. Okay, perfect. Okay, so this is always a good one to get started with. But someone asked, what meds and supplements destroy the kidneys or harm the kidneys or not safe for the kidneys?
You know, this is really tough because there's such a huge list of supplements and medications. So let me start off with the medications first. And it's basically a few general categories. So there are certain antibiotics that we start to worry about, and specifically those antibiotics can be names like vancomycin. They can be aminoglycosides like gentamicin or tobramycin for that matter. But it's not that you can't have these antibiotics. It's the idea that if you end up having these antibiotics for prolonged periods, we need to make sure we monitor your kidney function. And of course, if you end up having low blood pressure or there's changes in your fluid status, or God forbid you have blood loss, all of those could increase the risk for you to have kidney injury. There's a lot of HIV medications that are still on the market, tenofovir, etc., that can affect the kidneys. We know about it. When we do it, we watch your numbers very carefully. Antivirals like acyclovir is another common one that comes to mind. We use diuretics all the time. Remember, diuretics get rid of water out of your body. And if you use it in a setting where your blood pressure is low or you're already dehydrated, that can affect the kidney function. So, once again, it's not that any of these medications are bad. It's just that you have to make sure when you're using them, you're under the supervision of a doctor. Laxatives, especially enemas that are sodium phosphate based, those can cause kidney damage, and those are well known. The other thing that people forget is proton pump inhibitors or anti-acid medications, specifically PPIs, names like Prilosec, Prevacid, Nexium comes to mind. But PPIs can also affect it. Now, they don't do it just because you used it a short term. It's over extended periods of time. So those are just some broad medication categories. There's a lot of other ones that can also affect the kidney. So anytime you get started, your doctor and your pharmacist will always look at the medications you're on. When it comes to supplements, though, it's a massive, massive list. And if you go on kidney.org, for example, you can find a really good list of supplements. And those could be things like, we've talked about licorice root in the past, specifically certain types. Yohimbe can do it. Let's see, cat's claw, barberry, astragalus, all of these, depending on how you're using it, can definitely do that. So you just want to be aware that if you're worried about supplements, first is definitely there are pharmacists you can talk to. Of course, your nephrologist can answer that question. Kidney.org, we're not affiliated with it at all, but kidney.org is a great site to be able to look at. So the National Kidney Foundation puts out lots of wonderful information. It's unbiased. So you can use that to be able to get the answer you need in terms of is it safe or not safe.
Yeah. And they also have a list on that website, not only of like herbs or supplements that might be harmful, but also ones that contain potassium and contain phosphorus. Because obviously some people with kidney disease might need to know which ones contain that. So, all right. Someone asked, what advice can you give on kidney cyst?
Well, the kidney cysts have a classification, and it's based on the Bosniak classification system, which is Bosniak 1, 2, 2F, 3, and 4. And essentially, if you're below stage or Bosniak category 2, so if you're 1 or 2, we don't really worry about those cysts. If you're 2F, and by the way, this is criteria that you will see on the report from an ultrasound or a CT scan where the radiologist will read it. And what they're looking for specifically to classify it as Bosniak, they're looking for a CAT scan with contrast that gives the best picture. But what we do with patients is we'll do ultrasound so we don't keep exposing them to radiation. In my own clinical practice, if it's 2F, we will make sure we look for stability. That means that we're repeating the ultrasounds or sometimes CAT scans every 6 months for 2 years to look for stability. So what ends up happening is the idea there is you got to track the two F's. 3 and 4, that's where we actually refer to our urology colleagues because 4 requires surgical excision. Sometimes with 3, the urologist will say, nope, I think I can monitor this very carefully and not jump the gun. But 3 and 4 is where we end up going to a urologist. If you have a cyst, the first thing is if you're over the age of 50, everybody is going to have renal cyst over the age of 50. So remember that and don't get freaked out about it. If you have a cyst, it's a good idea to talk to your doctor and find out, is it concerning or not? And concerning means what's the border like? Are there sort of septations in the middle? Does it look solid in nature? Because if it looks solid, that's definitely concerning. So those are things that become important to understand.
Gotcha. That's helpful. And hi, it looks like we have people from Alabama and even a nephrologist here. So that's
Oh
awesome.
wow, that's awesome. That's
Yeah.
awesome. Well, thank you so much for joining as far as that goes.
Yeah. Okay. So a question we did get was what food to avoid after a kidney transplant. And I'll chime in on this, and then Dr. Hashmi, if you do too. But usually, foods to avoid after a kidney transplant kind of go into two categories. One, you want to look at food safety, and then the other is any potential food and drug interactions. So, when it comes to food safety, post transplant, and being more having a suppressed immune system, you have to be more mindful of some of those foods that are higher risk of foodborne illness. So you want to make sure that you are washing raw fruits and vegetables well before you consume them. Usually unpasteurized, like cheese and dairy, you would want to avoid raw meats, poultry, seafood, fish. Avoiding that, and then raw sprouts are usually things that would be recommended to avoid. And then as far as like herbs and botanicals, those are usually contraindicated post transplant because there's just not enough research on them in that population. And the other thing is that certain foods can impact how post transplant medications are absorbed in the GI tract. So things like grapefruit, pomegranate, bitter orange, and starfruit are oftentimes ones that might be on that list to avoid post transplant. So that's all I have on that. Anything you want to add, Dr. Hashmi?
No, I would just say, this is where working with a renal dietitian becomes very, very critical is, well, once again, medicine is becoming more and more complex and specialized. And this is why it's hard to be the jack of all trades anymore. It really is. There's no one person that can know everything about everything. So when we have patients who have a transplant kidney and stuff, what we tell them is, and same thing with CKD or anything else, it takes a team. We have pharmacists on the team, we have social workers, we have dietitians, and we have nephrologists. So we end up getting all of those people together to be able to take care of all of this stuff.
Yep. Okay. Are diuretics contraindicated with a high PTH or parathyroid hormone?
Yeah, so the answer is no, they're not contraindicated per se with a high PTH. Diuretics serve a very specific role. Now the question is what's going to drive PTH to be able to go higher? So if you have higher levels of phosphorus in your body, as your kidney function is declining, there's a feedback mechanism that's happening. Remember, PTH is phosphaturic, which means it's going to get rid of phosphorus out of your body. That's the whole point of PTH to be able to do. So it's being driven as a feedback system. And oftentimes, what we end up doing for the treatment of secondary hyperpara is we give you vitamin D analogs. And the concept there is it's feeding back and is slowing down or stopping that PTH from becoming overly active. But the PTH becoming higher is because it's a physiological process. And remember, as CKD gets advanced, we actually allow for a higher PTH to happen in the body, specifically because PTH resistance is a real thing that happens. So you need a higher PTH level. If the PTH level is too high, you get brittle bone disease. If the PTH is too low, you get soft bone disease. In both cases, either renal osteodystrophy or osteomalacia, you're dealing with two spectrums where there can be problems. And that's why we try to make sure that it's in the middle.
Okay, thank you for that. Is 200 milligrams of allopurinol daily for gout hard on the kidneys?
No, but the thing over there is you'll see that your doctor will lower the usage of that. The idea that uric acid can play in worsening kidney function continues to be controversial. There was some data that said high levels of uric acid would make the kidneys worse, and there was data that said it didn't. One of the things that I use uric acid as a marker for is how bad is your diet? And I can look at your uric acid and tell because uric acid will go up not just because of meat, it will also go up because of sugar. And so testing somebody's uric acid is a great way to be able to tell are they really sticking to stuff or are they just kind of not listening to anything you're saying and just eating whatever the heck they want. So allopurinol is used to lower uric acid, but remember, you are not really solving the underlying issue. The underlying issue is what's your diet like? Is it a diet that's actually promoting more uric acid in the body? Is it something that's loaded with meat? Is it something that's loaded with alcohol? Is it something that's loaded with sugar? And if so, why don't we take a step back and start there to work on it?
And we do have an episode on gout. So make sure you guys can go back to our past episodes. It's very likely under the diet section of our playlist, and you can check that out. This is an interesting one, Dr. Hashmi, and I don't know much about this. But what do you think about the new electronic kidney, BAK? I don't know if you know anything about
Let
that.
me see. The new electronic kidney?
Yeah, that's what it says. But I think we probably both need to look into that. So
I'm not sure about the new electronic kidney. I know that there's all sorts of artificial kidney models in the work. As you know, there's one from UCSF. They've looked at being able to use pig kidneys and see if that can work out. We don't have anything definitive yet as far as being able to use any of these things. So the answer is everybody's hopeful, including myself. But I haven't seen anything new. And if anybody who's joined us today, if you guys have any information, share with us on the chat because we'd love to hear from you. If you've heard something or there's a study that's come out, I'd love to hear about it because, as you know, it's impossible to keep up with every single study. But with the artificial kidney or the porcine kidney, that's a huge area of interest to all of us.
yeah. Okay, a question that was submitted ahead of time. Someone said they have stage 3 kidney disease, protein in their urine, and they're asking basically they don't understand how much protein, how much potassium, and how much phosphorus they need. Which, again, of course, we have individual episodes on this, but I'll quickly say a few things. Typically, chronic kidney disease, stage 3 to 5, not on dialysis, the protein equation is about 0.6 to 0.8 grams per kilogram of body weight. So you would take your weight in pounds, divide by 2.2. That'll give you your weight in kilograms. And then you can put that into that equation of multiplying it by zero point 0.6 to 0.8 grams of protein per kilogram of body weight. I always have to say is that if you are underweight or overweight or obese, you might need to use an adjusted or ideal body weight instead of your own weight. And that's something a renal dietitian can help you do. But that can at least give you some kind of rough ranges or guidelines for protein. As for phosphorus, there's actually no longer a specific, like you have to restrict to this many milligrams of phosphorus in your diet. It's recommended to adjust based on your labs, but also to take into consideration the different bioavailability of different phosphorus sources. And that's why phosphorus is so tricky. If we say, hey, everyone should have 800 milligrams of phosphorus a day, that doesn't take into account one, it's extremely hard to find accurate phosphorus information on a label because it's not required to be there, but also phosphorus is not absorbed equally. So phosphorus from plant sources like whole grains, nuts, seeds, and legumes are absorbed about 30 to 50%. Phosphorus from animal sources, so dairy, eggs, meat, poultry, fish is anywhere from usually 60 to 80% absorbed. And then phosphorus from additives, so like phosphoric acid, disodium phosphate, you find these in processed packaged food, that's usually absorbed about 90 to 100%. So if you avoid phosphorus additives, limit the animal products, and have more of the plant phosphorus that's minimally absorbed, typically phosphorus is a lot easier to control. And then potassium, again, it varies. It's going to be based on your individual health situation, your labs, and medications you might be taking that could raise blood potassium levels. But in general, a low potassium diet is about 2,000 to 3,000 milligrams of potassium per day. Moderate could be, 3,000 to 4,000, and then a high or unrestricted potassium diet is usually over 4,000 milligrams per day. And again, you might fall anywhere within that. But the big thing with potassium is that, especially in earlier stages of kidney disease, you don't want to be restricting potassium unless you need to, unless your labs indicate that, unless your nephrologist and your dietitian are telling you that you need to and telling you why, because there's a lot of benefits to foods that are higher in potassium. Okay. Any thoughts on keto citra or a keto diet for people with polycystic kidney disease? There's some promising data in animals, any human data.
Yeah, so I can't remember, Michelle. I think we did an episode where we talked about the keto diet, especially the plant-based version. So remember, what people understand as a quote-unquote keto diet and what they follow out there, that is not the medical version of a keto diet. That's number one. Number two is you want to be able to still realize that things like saturated fat aren't going to be good for you. So as you've heard us talk about it, we emphasize polys and monounsaturated fatty acids as the source predominant of the fats that you're getting. So we're saying that it's a predominant plant-based keto version of a diet. You can use keto citra as an option to be able to increase the beta hydroxybutyrate inside the body. The whole mechanism behind things like cysts, like PCKD, is if you remove the sugar from the body, the cyst growth slows down. Very good data to be able to support that. Not only that, we also find that if you do a keto version of not a keto version, but if you do the ketogenic healthy version of the diet, for CKD, you can also find that you can slow down the CKD progression itself. Part of the reason why all of this stuff works is what you end up doing is you're reducing the amount of sugar that's filtering through the kidneys. That makes a difference. If you're doing the healthier version, you're also reducing the salt that's going through it. And the ketone bodies themselves have all of these secondary benefits. So bottom line behind all of that is the data is fascinating when it comes to this. And remember, when you look at epilepsy, that's where the data comes out in terms of the original ketogenic diet. You can look at migraines, the data is there. You can look at early Alzheimer's and dementia, the data is there. So there's a number of things where being able to be mindful about how much of the sugar you're adding is doable. The biggest drawback to a ketogenic diet is you can't go on it and off of it, on it and off of it. When you go on it, you have to decide you're going to stay on it, because when you go off, your body does not know how to handle the sugar. And in one of the videos we did, I presented the data that showed how when you reintroduce the sugar, you cause all of these cells in the endothelial lining to die off. And this was a study that was published in Cell. It's a few years back, but it was a fascinating study to show how sort of going back and forth would end up doing a significant amount of damage. So if you're going to go on a diet, especially if you're going to do something as restrictive as a ketogenic diet, just kind of take a step back and decide, is it something you can stick to? Because if you can, awesome. And by the way, if you can't do it, Keto Citra is great because you can still get all the benefits of having a ketogenic diet, because you're getting those ketone bodies, the beta hydroxybutyrate, without having to change your diet drastically. And that's where some of the benefits really comes in, is you can use Citra, but there's a lot of also supplements that are available. You just want to make sure that you're getting a quality supplement that allows you to get the beta hydroxybutyrate, etc. And just be careful of how much salt they're adding. So a lot of the ketones are linked to salt as a way of delivery. So you can inadvertently be consuming a lot of sodium without even realizing it.
Yeah. And there are renal dietitians that specialize in polycystic kidney disease and doing plant focused ketogenic diets. So, I mean, my website's plantbasedkidneys.com, but you can reach out to me on there. And I usually have information of dietitians. Again, they're specialized more in that. Like, I don't even usually work directly with people with polycystic kidney disease. There's better dietitians to do that. So, okay, one of the questions submitted ahead of time was about hyperaldosteronism, and they said they're dealing with hypertension that's resistant to medication, and should they push for more tests to check for this?
Well, so I think some of it is you got to understand what the heck does resistance hypertension means. So the formal definition of resistant hypertension is that if you're on three different blood pressure medications and we can't control your blood pressure, that is the formal definition. And out of those three, you want one of those to be a diuretic. So whether you have an ACE inhibitor, you have a calcium channel blocker, and then you have a diuretic, but you want one of them to be a diuretic. The other definition is that your blood pressure is controlled, but is taking like four medications to control it. That's also called resistance hypertension. But remember, when you get to the idea of resistant hypertension, you got to understand there's something called pseudo resistant hypertension. This is just a fancy word. And in other words, is what we want to make sure is, are you measuring your blood pressure accurately? Because if you're not doing it accurately and you're getting higher blood pressures, that could be a problem. For example, sometimes when people take their blood pressures, their legs are crossed, their bladder is full, they're not sitting upright, they're not relaxed, they might have just done something stressful. Or, there's this thing where people go to the doctor's office, they have what's called white coat hypertension, or the second you slap a cuff onto their arm, the act of squeezing just causes them to freak out a little bit and their blood pressure goes up. So all of this things can actually make a difference as far as that goes. And then in our clinical practice, one of the things we find is sometimes nephrologists trying to be good and doing the right thing, but sometimes they give medications that are BID, meaning twice a day, or TID, three times a day, and patients aren't able to stick to those regimens. One of the reasons that I like to simplify the regimens and try to stick to medications that are once a day is not so much because they're going to be more efficacious, it's that the compliance is going to be greater. So you got to rule out the pseudo resistance hypertension. Then comes the question of not just hyperaldosteronism. Remember, aldosterone causes you to hold on to salt, get rid of potassium. So hyperaldo is more salt, less potassium, and as a result, it's causing water to stay in the body and getting high blood pressure. But the other questions are, what if it's not hyperaldo? What if it's because there's renal artery stenosis, meaning the blood supply that's going to your kidney, there's a kink in that. And if there's a kink, that kink will cause hyperaldosterone and will cause that aldosterone levels to shoot up higher. What if there's things like pheochromocytoma, which is basically you're releasing all these catecholamines like norepinephrine, epinephrine? That can be happening. Sometimes there's something known as coarctation of the aorta. Basically, there's a kink in the aorta, is a simple way to explain it, where that's leading to higher blood pressures happening. So all of these things can happen. And don't forget, the most common thing for people having difficulty reducing their blood pressure is sleep apnea, one of the most underdiagnosed things in my humble opinion, because as an obesity medicine doctor, you'll be surprised how many of my patients suffer from sleep apnea, and as a result of it, their blood pressures are harder to control. As soon as we control the sleep apnea, things get better. Now, assuming all of that is done, then your doctor will start with, of course, electrolytes, because what they're looking for is, are you running low potassium? Are you running low potassium? Is your bicarbonate levels higher? So there's a metabolic alkalosis and the potassium is on the lower side. And if so, that can be a clue that we need to do further workup. We'll do a 24-hour urine test to be able to look for how much aldosterone are you secreting, what's the sodium content like. All of those things will be important. We'll do a morning blood test and we'll look for certain things such as the morning plasma aldosterone concentration. But don't fall into the trap that it's only aldosterone. If you have resistant hypertension, 3 or more meds not controlling your blood pressure, talk to your doctor so they can start one by one to look at the overall picture and figure out which one of those things is really affecting you.
All right, thank you. All right. Someone just saying that this is so helpful and they're watching from Arizona. Thank you for
Arizona.
joining us. Yes. Okay, I'm trying to get through. There's a lot of questions in here. So, okay, two of these will kind of probably go hand in hand. One asking if there's a specific diet for controlling high PTH, and then another question: should people with kidney disease get their vitamin D levels checked? So maybe to start that off, Dr. Hashmi, can you just kind of explain if we can, in a non super complex way, just the PTH, vitamin D, calcium, phosphorus connection. So then we
Well,
can answer those two questions.
I think that's really complicated for,
We'll do a whole episode on
and
it.
we actually have an entire video that talks about the entire chain link reaction. But remember, the bottom line here is vitamin D is needed in the body to be able to turn down parathyroid from being too active. That's the bottom line. If you're getting a lot of processed foods, if you're getting a lot of animal foods, and you're increasing phosphorus, and your kidneys are struggling to get rid of phosphorus, that phosphorus is going to drive PTH up. So, the first thing we do is we look at inactive and active forms of vitamin D. So, if your PTH is high, inactive is what you get over the counter. So, if you go to the store right now and you get vitamin D over the counter, that's considered inactive. And that's 25 hydroxy vitamin D. It'll go to the kidneys, it'll get converted to the 125 hydroxy vitamin D. The challenge some people have is when they have kidney disease, you will get the over the counter vitamin D, but because that portion of the kidney is damaged, you're not converting the inactive to the active form of the vitamin D. Therefore, your nephrologist will say, Mrs. Smith, you need to take over the counter vitamin D, but I'm also going to give you calcitriol, which is the active form of vitamin D. So remember, there are two forms of vitamin D, and your nephrologist may give you both types. And if they do, it's not because they don't know what they're doing, it's quite the contrary. They know exactly what they're doing. And because your kidneys can't convert, you need both. Remember, inactive or the 25 hydroxy vitamin D has a lot of functions in the body. And the active form also has functions in the body, and you need both.
Yeah, and that's a really important point because a lot of times I would see when I worked in dialysis, I would see people, they'd be started on the active form like calcitriol or hectorol of vitamin D to bring PTH levels down. And then they would be told to stop taking their vitamin D3 orally because now they're taking this active form. But there are other benefits of that vitamin D3. So to answer that first part of the question for the high PTH is definitely controlling blood phosphorus levels and avoiding excessive phosphorus intake is huge. And then, should people with kidney disease get their vitamin D levels checked? As a renal dietitian, I definitely recommend it. I think, in general, a lot of people are actually deficient in vitamin D and don't know it. And people with kidney disease are usually at an even higher risk of being deficient. I think, from a standpoint, I don't know if it like insurance reimbursement or what, at least in the United States, there's like I was even told one time, oh, well, vitamin D is a more expensive test. So I don't know if you have anything on that, Dr. Hashmi, but ultimately, I've had clients who like, they're like, you don't need to check it. We don't need to check it. And we kept pushed for them to order the test. And then they had very low vitamin D levels and needed to supplement. So I definitely think it's one that should be checked. Also, because you want to avoid excessive vitamin D, just like you want to avoid having deficiency of vitamin D.
Right. So the challenge with vitamin D is several. First one is there's no standard on what's considered to be an optimal level. And there's all sorts of gurus out there who come up with their own version of what it is. But if you look at IOM, which is the Institute of Medicine, and etc., nobody really understands. The consensus there is that below 20 is really, really bad. That's the consensus. But after that, where is that sweet spot? And some people feel that really between 30 to 60, somewhere in there is probably the sweet spot. Some people feel that around 45, 50 is the ideal number. What's the challenge with if a little bit is good, why not do a lot of it? Because a lot of people feel like, well, my level should be like 80, 90. Why not? Because vitamin D is going to cause calcium to get absorbed from your gut. The problem with having calcium absorbed is it has to be used properly. If it's not used properly, it's going to end up lining your blood vessels and calcifying all your organs and all your blood vessels. This is part of the reasons why a lot of people, including myself, when I take my vitamin D, I take D3 with vitamin K2. K2 is tricky because we don't actually know what the optimal dosage of K2 is. All the recommendations around vitamin K are based on K1. But the thing with K2 is K2 will help to deliver will help to deliver the calcium to your bones and not to your blood vessels. So it's very good at transporting calcium away from your blood vessels towards the bones. And that's why we like D3 with K2 for that purpose. And for K2, we talk about the idea that you're looking for MK7. And the reason for MK7 is not because it's the most abundant, that's MK4, but because from a bioavailability perspective, you're going to get much better bioavailability with MK7. Otherwise, you're just kind of wasting your money. So when you see a K2 that's got all sorts of different MKs in there, ignore that. That's a waste of money. You're looking for one that has high bioavailability. So with vitamin D3, the bottom line is I think somebody put right here that they should go ahead and their vitamin D from the sun. Look, right now the issue with the sun is a whole lot of things, including skin cancers and all sorts of skin damage. It becomes very hard. Vitamin D3 is very simple. By the way, there's not a whole lot of difference between D2 and D3. So if you're going to do it, D3 tends to be more popular. There's slight differences in terms of how the bioavailability works, but overall, outcomes wise, I don't know of any study that shows a difference in D3 versus D2. In general, it may be a good idea to think about K2, but there is no formal recommendations and there are no guidelines to say if you should or should not take K2. The problem is by the time the studies come out, I'm going to be like 80 years old. So to me, it makes sense for me personally to use K2 with it.
Okay, next question. How much sodium for a GFR of 25? So first of all, I think one thing that's important is the general recommendation for people without kidney disease is usually less than 2,300 milligrams of sodium per day. For people with kidney disease, it's typically recommended less than 2,000 milligrams. And then, like American Heart Association has more strict guidelines, especially for people with high blood pressure, which is a lot of people with kidney disease. And that's usually around 1,500 milligrams of sodium per day. So the key is a low sodium diet is not a no sodium diet, but most people consume excessively high sodium intake, upwards of 3,500, 4,000 milligrams a day, a lot of which comes from eating out, fast food, restaurant food, and then highly processed food. So, um, okay, Dr. Hashmi, do you know anything about staghorn stones? Is that a concern for someone with stage 4 kidney disease?
Yeah, if you have a staghorn stone, remember staghorn stones are really large. They follow how the blood vessels are going, so you can see inside the kidney. I wish I could show you guys a picture, but if you Google staghorn stone, you'll see they're very, very large. And as a result of it, the only way to really take them out is through surgery. And as you know, whenever there's a surgery being done, there's a chance that that surgery itself can damage it. But the simple answer is yes. Staghorn stones can, of course, damage the kidney infrastructure, which means they can make your existing kidney function worse. The good news to remember is in general, for kidney stones, the biggest thing you gotta do is you have to drink 3 liters of water a day. There's like no other ifs, ands, or buts. And it's a great thing is if you like have a water bottle, like I keep mine and I fill it up a couple of times a day. And what I do is when I wake up in the morning, the simplest trick that you can do is I always start my day, I drink 2 large glasses of water to start my morning. because you're waking up from a fast. And what a great way to break a fast than to just go and drink water, right? So go pee first or pee after, whatever you want to do. But then after that, start your day with a couple glasses of water. And then after that, realize that if you want to have a minimum amount of fluids, start with a container. And most of these containers are 1.1, 1.2 liters. And
Yeah.
so as a result, you can drink two of those, and the rest you're getting through liquids you might be drinking with lunch, etc. But make it a point to finish these every day, and you'll get your fluids. But drink your fluids. There's other things. When you're dealing with acidic type stones, we will give you things like citrate. Citrate will help to be able to prevent the stones from getting larger. So citrates are stone inhibitors. And so there's treatments that your doctor can prescribe specifically for the type of stone you have, and that can make a big difference as far as preventing stones.
Thank you. Okay, this is a good question. Are cramps common with kidney disease? They're dealing with that right now. Cramps are definitely not fun. Are they common with
I
kidney disease,
mean,
Dr. Hashmi?
it's difficult because it's an electrolyte issue, right? So if your electrolytes are disordered, especially if they're on the lower side, then yeah, you can definitely get cramps, but we would check the electrolytes on it. One thing I'll tell you is a lot of our patients that suffer from cramps, especially when they're on dialysis and they go through these fluid things, something that makes a is very cheap is get a foam roller. A foam roller is 10, 15 bucks on Amazon. You don't need anything fancy. You can watch a couple YouTube videos on how to be able to give yourself a soft tissue massage, and you'll be surprised. Just doing a little bit of foam rolling helps to do that. And then stretching. Yoga is one of the most simple and effective things. And if you don't like yoga, just watch a YouTube video on some very basic stretches you can start doing. As we get older, we get stiffer. And that means you have to focus on stretching more. And a lot of the patients that I deal with in the dialysis setting, unfortunately, they're very sedentary, meaning they don't really like to move that much. And what's crazy is I give you a pill, and then I give you another pill to fix the side effects of the first one, and then I give you a third pill to fix the side effects of the second one. When instead of doing all of those things, some of the basics of are you stretching every day? Are you moving every day? A low impact thing is get in the water. If you have access and you're blessed enough to have access to a pool, get in the water, walk, do pool exercises. But activity and active stretching makes all the difference. I have no connection to Peloton, but I'll tell you, I use Peloton. I love the fact that they have those 10-minute stretching videos. That's what I do with my two daughters because I find that I'm not one to do a long yoga session. I can't. It's just not in my blood. But 10 minutes is doable, and I can get a great full body stretch out of it. And by the way, you don't have to do Peloton. You can just go on YouTube. There's tons of free videos.
All right. We did have another question on polycystic kidney disease, and what they should do as of right now. And I think that, I mean, obviously we addressed that one earlier, and we also have several episodes on that. So definitely recommend to check those out. Someone said, why do kidney disease patients require additional magnesium supplementation?
So it's not necessarily that, is kidney disease patients, most people in general don't have enough mag anyways. And as you know, there's about 10 different types of magnesium, so each one has a different role. If you're talking things like constipation, you might be talking about things like mag oxide, mag citrate. If you're talking about stuff that's going to cross the blood brain barrier, then you're talking about magnesium threonate. If you're talking about stuff that's going to help you sleep, then you're talking about mag glycinate. So first, there are lots of different types of magnesium. Second is we can all use a little bit more magnesium in our bodies. And me personally, I take mag glycinate because it helps me to relax in the evening. I find that the quality of my sleep is really good. It's hard to get toxic. And by the way, mag glycinate is not something that helps to have bowel movements and stuff like that. So if you're worried about that, it's not going to affect that. Mag-glycinate, the glycinate portion of it tends to relax you. It's more bioavailable, just like magnesium threonate is. But if you have constipation, then it's like citrate and oxide, all those things, like some of the over-the-counter milk of magnesia, etc. Those are different treatment in itself. But magnesium is vital. And we already have, I think we did an episode a while back where we talked about all the amazing benefits of magnesium. But it truly is a remarkable thing to be able to have.
Yeah. And before everyone goes and buys magnesium supplements, Dr. Hashmi, what about with people with late stages of kidney disease and as renal function declines, it could be harder, or you can see more elevated blood magnesium levels?
Once again, mag is very hard to get toxic on. So remember, when women are pregnant and they may have preeclampsia or etc., and we give them tons of mag infusions and take them to a higher level, it really takes a lot. Now, that being the case, whenever you have decreased clearance, you got to know that mag is going to hang around more. So, in general, whenever you're going to start something, first tell your nephrologist, because what we'll do is we'll check it on a blood test. This is one of the things that nephrologists can always do is, and that's why arbitrary statements that some of the folks on the internet make is like, have all this or don't have any of this. None of that holds true. At the end of the day, you want to be scientific. The definition of being scientific is measure it. If you don't measure it, you can't make a generic statement around it. And that's why we always measure. Same thing with potassium, same thing with phosphorus. We need to see where your numbers are at so we can start to modify your diet. And so, one of the criticisms of things like a plant based diet is people will say, hey, I don't want you to follow a plant based diet because your potassium is going to go up. Well, that's not necessarily true. Now, you may be somebody that's already on medications and we start giving you some oranges or bananas and your potassium shoots up, but that's like throwing the baby out with the bathwater. We're not going to say stop all plant-based foods because your potassium is high. We'll make those changes based on blood test.
All right, perfect. Okay, this is a good question. Someone's asking their 86-year-old mom has stage 3A kidney disease, GFR is 56. They're asking about if there's any health benefits of taking black seed oil, and what about apple cider vinegar? Is it safe or should it be avoided altogether? As far as, I mean, apple cider vinegar, there's no problem with having apple cider vinegar, but don't drink it straight. You don't want to be taking shots of apple cider vinegar. You can use it in cooking and dressings. You can mix it with water if you wanted to drink it. But I would definitely say you don't need to be buying apple cider vinegar gummies and supplements or anything like that. Just to use that vinegar or other vinegars if you prefer that in your cooking, or if you are drinking it, mix it with water. Don't drink it straight. And I don't know. I'd have to look into black seed oil. Do you know anything about that, Dr.
There's no
Hashmi?
benefits to either one. I think the challenge there is when we're hurting, it's hard because we're looking for hope. And hope is very dangerous on the internet because people prey on the fact that you're looking for hope. And as a result, they'll say all sorts of things. And I can tell you, I've heard so much about, take this and it's going to cure your kidneys. And I saw a video the other day, had like over 1 million views. And they were talking about some oil. And they said, if you just do this, you're going to recover kidney function, be off dialysis. And the problem with those statements is they prey on people's weakness. So, once again, the truth is not as exciting, it's not as sexy, and so it doesn't sell as well. And that's part of the challenge that Michelle and I always have is we try to present to you what is based on literature where there is not just one random study that somebody paid to publish in a journal, but these are reputable studies, reputable journals by reputable authors that have been replicated. And that's what you want to rely on. But I can tell you, I've been on the other side, and when you're hurting and when your loved one is hurting, you are looking for answers, and whoever comes along, you're willing to think that that will help. And that's hard.
Yeah. Okay, we had a question that was submitted. asking about any possible causes of a baby being born with one kidney, and then just any protective measures to protect that one single kidney.
Okay, so I don't know of any specific causes that would cause a baby to be born with one kidney. Sometimes there's just renal agenesis, and that can happen. Sometimes there's a blockage of the blood flow to that kidney, so the kidney actually shrank, and that's why it never grew. But in general, what you want to remember is if you have one kidney, because remember, a lot of people donate their
Mhm.
kidney, right? So if it was something that was very dangerous, nobody would be donating a kidney. Yet people who donate a kidney, they go on to live full lives the rest of their life and they're okay. But what are the things you got to watch out for? Is three basic things that are very important. Blood pressure. You got to make sure your blood pressure is not running high, because if it is and you have one kidney, you're going to put more pressure on it. Sugars. If you become a diabetic, you're going to drive more sugar. Now you only have one kidney, and as a result, you have less reserve. And the third thing is weight. Weight is absolute. So even if you come to me and you say, I'm a 250-pound pure muscle, 4% body fat bodybuilder, you're still going to put way too much pressure on the kidney. Unfortunately, the data shows the longest living people on the planet are not the biggest. They actually happen to weigh the least, and they happen to have good blood pressures, and they happen to have good sugar levels. And so the take home there is this: diabetes, blood pressure, and weight still continue to be the critical things. And same thing for supplements or anything extra. Don't put that in your body, and just make sure that you have a doctor who keeps an eye on it.
Okay, this is a good question. If someone has nephrotic syndrome, they are on dialysis, have end stage renal disease. If they get a kidney transplant, will their body attack that new kidney?
Well, whether the body attacks it or not has nothing to do with the nephrotic syndrome. It has to do with what's causing the nephrotic syndrome. So, for example, if you have an autoimmune condition, let's say you have membranous lupus nephritis. So, you have lupus in the body, the specific type is membranous, and that's attacking the kidney. That can cause you to spill protein in the urine. And after you get the transplant kidney, if the lupus is still there, it could act up, it could attack the transplanted kidney. So it's not so much that you have nephrotic syndrome, it's that what is the underlying disease? And that underlying disease could potentially affect the new kidney. So the answer to that is yes. And you have to make sure that you're taking all of the necessary precautions to, of course, prevent that from happening.
All right. Dr. Hashmi, do you know anything about stem cell treatment in the United States for kidney disease?
Still waiting. That's the bottom line. There's a lot of unscrupulous characters that are saying all sorts of things that, you'll get these stem cells and it'll fix your kidneys. Unfortunately, we're still waiting on data around that. Stem cells hold a tremendous amount of promise. But also keep in mind what exactly happens with the stem cells. It's a cell that develops into what you want. But if a cell develops into something you don't want and it's growing, that is cancer. So, as people get all excited about stem cells, they also have to be very careful that if you have unrestricted growth, that's cancer. And so the idea there is not only to have growth, but to have specific growth in that part so it develops into the cells you want. For example, stem cells developing into specific kidney cells or nephrons and not anything else. And then for them to stop after they've grown. Because if they keep growing, that's by definition cancer. And that's why it becomes so concerning.
Thank you. Okay, so a question was, what's the issue with fried food? Does it make a difference if I use an air fryer? So typically the concern with fried food and over consuming fried food is that usually oils, like trans fat, saturated fat are often used. It's usually high sodium. An air fryer is kind of like a convection oven, so it's having heat and then the fan, so it can help get help food get really crispy with using little to no oil. So air fryer is definitely not the same as deep frying. And I would say there's tons of great recipes online for making things in an air fryer that would normally be deep fried. And just know if you don't have an air fryer, if you that's not in your budget to get one, you typically can in a convection oven still get nice crispy food without having to deep fry something. Do you use an air fryer, Dr. Hashmi?
I do. I have an air fryer at home. We love our air fryer.
I
Absolutely.
I my husband told me I have too many appliances. So I don't have one, but I do everything in my oven and I've borrowed one before, but it's on my list once my toaster oven dies. I'm gonna get a air fryer toaster oven combo. All right, let's see. Do products like SRIAAs work? I don't know. Do you know what that is, Dr. Hashmi?
SRIAs?
AAs.
No, I don't know what that is. Let me find that comment and see. Maybe I'm just not understanding it properly.
Okay, well, we get to that. Um, sorry, there's a lot of these here. Do have a couple questions on sodium bicarbonate. And is sodium bicarbonate good for people with kidney disease stage 3 to take? And I definitely one refer you. We have a couple episodes on sodium bicarb and alkaline and acid producing diets and prowl and potential renal acid load. But Dr. Ashmi, do you think that's something that's good for
Well,
people with kidney disease to take?
no, so remember the issue with sodium bicarbonate is the sodium component, right? The concept behind bicarbonate is very important in terms of overall mortality, in terms of the kidneys getting worse. So this is why we know that when people have metabolic acidosis, we want to correct it because we know if we leave it there, it's going to cause all the calcium and phosphorus to leach out of the bones. The risk of death is going to go up. The acid is going to cause the kidneys to fail faster. So the nature's version of sodium bicarbonate is fruits and vegetables. So in other words, we're trying to alkalinize the blood. And if you want to alkalinize the blood, very simple is shift towards a predominant whole food, plant-based diet, not these artificial meats and all this other crap that everybody is all raving about. Look, whenever you start to see that McDonald's or some other place has gone plant-based, you know there's a problem, right? So be very, very careful. Nature's version is still fruits, vegetables. All of those things are going to be awesome for you, and they're going to reduce the acid that's present in the blood. So we use sodium bicarbonate when we absolutely must, but sometimes we'll give people citrate, like potassium citrate. Still worried about the potassium level, so that becomes an issue. Sodium citrate, still worried about the sodium, so that becomes an issue. So you can see how nature has already figured out how to be able to keep you healthy. And if you want to do that, reduce the animal products in your diet. That's it.
All right. Get through these. What I love to eat. Someone said, what is left to eat when you were struggling with hunger all day? At a level of 45 total grams of protein. Um, so I mean, a few things with that. One is that it's important to keep in mind that if you are lowering protein in your diet, then carbohydrates and or fat have to go up. Otherwise, you're likely not going to get enough calories in your diet. So that's something that you have to keep in mind. So carbohydrates, if you're increasing that, we don't want it to come from, added sugar and highly refined carbs. We want high fiber carbs. We want those fruits, veggies, legumes, whole grains, nuts, and seeds. And then as far as fat goes and increasing fat, we don't want it to be, trans fat, saturated fat. We want it to come from um, monounsaturated or polyunsaturated sources. And so, whether that's avocados, nuts and seeds, some ground flaxseed, chia seeds, extra virgin olive oil, those are all things, but you can't cut a whole macronutrient and then not increase one of the other ones without me not getting enough calories. And so again, I highly stress working with a renal dietitian for that because they can look at your needs and where is it better to go up a little bit up on fat and carbs, just on fat, based on your other health history and your labs.
And Michelle, I wanted to go back to that question about SRIAAS. So I Googled it right now because I'd never heard of that. So apparently, if I'm reading this correctly, it's basically some herbal treatments for kidney failure. So let me give you this one word of advice. I see people who come from Fortune 500 companies, high-powered CEOs who have all the money in the world and their kidneys are failing and they're going on dialysis and they're getting transplants. If there was something, trust me, it wouldn't be a secret. These people who have all of the means and all of the wealth available to them, they're doing it. And I have yet to find something like that on the herbal side where I could honestly say, yes, if you take these herbs, you're going to do great. The answer is it does not exist. We don't know about it. And be careful about these websites that look really well and they're worded really well. I don't know anything about it. I don't know if they work or they don't. My job is to look at randomized studies as much as possible that are independently replicated, not some small study, because nowadays anybody with a little bit of money can go and put out a study and say, oh, it's been studied and it works. So just be careful. That's all I'm saying. I don't know these guys are or what they're doing or what this evidence is. I can't say any of that. But all I can say is, I look at everybody who's joined us today and here as part of our family. And with my family, I just want to say is the first thing is do no harm, keep you safe. And that's where I start.
Okay, we'll get to a couple more of these and then we'll already be at 7 o'clock. But someone asked, does dietary protein intake affect patients with IgA nephropathy compared to other types of kidney disease? So would they still, I guess, be recommended that lower protein diet?
So IgA versus other kidney disease, if we would recommend a lower protein.
Lowering does protein intake affect like people with kidney disease with IgA nephropathy the same as it does other forms of kidney?
Absolutely. Whether you have IgA, whether you have lupus nephritis, whether you have membranous, whatever it is, at the end of the day, what we do know about protein is acidic. It's going to drive more pressure on the kidney. So that's why we're trying to back down. So it does matter.
Yeah. Okay. I know some of these are people are having conversations about the vitamin D. Someone said their family doctor thanked them for telling her about vitamin K2. So they didn't know that. So it's good you were able to educate your doctor. Okay. What helps with swelling in your legs when you have kidney disease?
Yeah, so remember, swelling is about, in a complicated manner, it's about pressure that's inside your blood vessels that's forcing fluid to go out. And then there's stuff that's trying to pull fluid back in. And as we start to lose protein in the urine, we have proteinuria. What you're going to see is you're going to have more fluid that leaks out of the blood vessels, gets stuck inside tissues, and can't come back in. So the first thing to remember is the reason we tell people, hey, elevate your legs is because we're trying to get that fluid to move around more so that it can start to recirculate, come back into the blood vessels and get out. If fluid stays around your feet for too long, as you know, you can get ulcerations over there, you can get venous stasis, and all sorts of bad things can start to happen because gravity is pulling it down. There isn't anything magical. When we give you diuretics to make you pee more, the idea is we're slightly dehydrating the inside of the blood vessels. And we're hoping that by dehydrating a little bit here, will cause that fluid on the outside in the tissues to come back in. Then we give a diuretic again. So, in other words, the concept of a diuretic is you want to be on a diuretic 24/7, ideally. This is why sometimes when patients end up in the hospital and we give them IV diuretics, and they're like, oh my God, the IVs work so great. Well, part of that is because we gave them to you around the clock, and that's why they work so great. And so that what you can do on your own is you'll get the diuretics. Don't take it once a day. If you're on Lasix, which remember the word Lasix stands for last 6 hours. That's why it's called Lasix. In reality, it only lasts about 4 hours. It's not 6 hours, but that's how it was named, Lasix. So Lasix lasts 4 to 6 hours, and that's why you want to give it 3 times a day, sometimes 4 times a day, just so that the diuretic free interval is reduced and slowly we can get the fluid out of the blood vessels, suck some fluid back in, and get it out again. Of course, cutting down on salt is going to be very important because of the fact that you don't want your body to start having more fluid retention stuck in there. So, cut what's going in, increase what's coming out. Sometimes we do fluid restrictions on patients specifically because reducing the input. We do diuretics to increase the output. We try to make sure there's stockings or something. We're elevating the legs, still exercising so you have mobility. But those are just the basics.
Okay, we're at 7 o'clock. So all the questions we didn't get to, please join us next month. We're doing these every month. So thank you guys for joining us. Dr. Hashmi, where can people find you if they're looking for you online or Instagram?
Yeah. So Instagram is just my name, Sean Hashmi MD. On YouTube, there's another channel which is Self Principle. And on that, we have a live show every Friday. It's 30 minutes only, where we go through a specific topic related to nutrition, longevity, or kidney disease. You're welcome to come on that one. That's on Fridays from 5 p.m. Pacific Standard Time to 5:30.
Awesome. And I'm on Instagram, plant-based.kidneys, website, plantbasedkidneys.com, and then YouTube for more like recipes and cooking for plant-based and kidney disease. Though YouTube is Plant-Based Kidneys Kitchen. So that's where you guys can find us, and we will see you guys all in March. Thanks for joining us.
Thanks,
Bye,
guys.
Dr.
See you
Ashmi.
later. Bye bye now.